Good day, and welcome to the University of Maryland School of Medicine. My name is Rick Matteson. I'm the Executive Director of Student Research Education and Dual Degree Programs, the MD Master's Program. And I'm mainly here to talk to you this morning about our dual degree programs, and then I'll have a little bit to say about other initiatives that take place through the Office of Student Research, which I am also a part of. My email address is on this slide in case you have questions later. Please feel free to send me an email and ask those questions. Okay. We currently have 7 MD Master's programs that are listed here. And they provide medical students with advanced training in specific areas to complement and enhance your medical training and to also maximize opportunities after you graduate. So let's just briefly go through these programs. There's an MD Master's in Public Health, an MD Master's in Clinical Research, and an MD Master's in Cellular and Molecular Biomedical Sciences. I'll have a bit more to say about each of these in a few minutes. But those top 3 are completed totally within the School of Medicine. The other programs are in partnership with some of our sister schools. These include MD Masters in Health Administration, Masters in Bioengineering, and an MBA. Those are all master's degrees that are offered by University of Maryland at College Park. And we have one dual degree program that's offered through UMBC. That's the MD Masters in Public Policy. So these programs have a lot of general design features that I'd like to talk about just for a minute. So these are designed for students to be able to complete both degrees in less time than would be required if you were to do them separately or sequentially. And this is accomplished in large part by sharing certain degree requirements. For example, one requirement in each of the master's program, and I'll talk about these in a few minutes, will be a major project. It could be a master's thesis, a capstone, or a professional quality paper. And this other project will simultaneously satisfy the scholarly project component of the FRCT course. I'm not sure you've heard about FRCT. I'll talk more about it in a couple of minutes. This stands for Foundations of Research and Critical Thinking. It's a course that requires each one of our medical students to do a scholarly project, which is most frequently a research project. But as I said, there's a component of each one of the master's programs that will simultaneously satisfy the FRCT scholarly project requirement. In most of these dual degree programs, there are certain courses that can be used towards elective credit towards the MD degree, but also used as course requirements for the master's degree. These we refer to as shared courses. They're simultaneously effective for both degrees. All of these dual degree programs are designed to be completed in 5 years, and the bulk of the master's coursework is done in what we call a step-out year that must be taken between years 3 and 4 of the new medical school curriculum. Let me just briefly say a few things about some of the specific programs. The MPH program is directed by Dr. Diane Marie St. George. And this program, one of our most popular dual degree programs, is for those students interested in combining clinical expertise with an understanding of public health concerns. There are 42 credits required for the MPH, and all of these courses are taken here in the School of Medicine. One of the important advantage aspects of this program is that there's a tuition discount. MPH only students pay for the entire 42 credits, but dual degree students pay for only 30 credits. 3 academic concentrations are offered in the MPH, community and population health, epidemiology, and global health. So the MPH program mission basically is to advance the health of diverse populations in Maryland and elsewhere by providing graduates with the knowledge and skills necessary to investigate causes, prevention, and treatment of certain health problems, to integrate public health practice into their future professional careers, develop collaborative public health initiatives in teaching, research, and service, and serve as public health leaders at the community, state, and national levels. So let's go on to the Master's in Clinical Research program, directed by Dr. Kristen Stafford, whose picture is there. The goal of this program is to train future physician scientists in clinical research. The graduates will be able to identify important clinical research questions, develop clinical research protocols, including IRBs, conduct clinical investigations, interpret findings, and perhaps most importantly, how to write a competitive external funding application. There are 30 credits required for the Master's in Clinical Research. All of the courses are taken at UMB and include Principles of Epidemiology, Introduction to Clinical and Translational Research. I won't read all of these. You can look at these yourself, but there's a number of required courses and a number of electives that can be used to fulfill the 30 credits required for the master's degree. A master's thesis or research practicum course for the master's degree will simultaneously satisfy the FRCT scholarly project requirement. Our newest dual degree program is the Master's in the CMBS Master's program. It has a new program director. Dr. Ivy Dick was just appointed as the program director for this program, Cell and Molecular Biomedical Sciences. This fills a very important need that we had for medical students who wanted advanced training and experience in doing basic science research. So the program focuses on basic science research and combines traditional areas of biomedical study, including molecular and cell biology, neuroscience, pharmacology, physiology, cancer biology, and genomics, into a unique interdisciplinary graduate training program that can be tailored to the interests of the student. Students will gain expertise in the study and implementation of biomedical research and will be very well prepared for a future career in academic medicine. 30 credits are required for the master's in cellular and molecular biomedical sciences. All of the courses are taken at UMB and include important topics, of course, like biostatistics, research ethics, and an enormous list of possible electives that allow students to tailor the degree to their specific interests. There will be courses identified that can be shared between the MD and the master's programs. And at this point, I haven't mentioned this yet, but a lot of these programs are under a little bit of flux because of the development of the new curriculum. So courses that could have applied towards the CMBS and the MD degrees in prior years have to be looked over and decided what's appropriate going forward. But there will certainly be courses that can be shared between the two degrees. A master's thesis done in the CMBS program will satisfy the FRCT scholarly project requirement. Another example of that feature. I'd also like to briefly mention the Master's in Bioengineering program. This is a master's degree that has been working very well in partnership with College Park. The main goal is to broaden the educational and research scope of physicians in specific bioengineering fields. Important examples include biomaterials and tissue engineering, biomedical device development, biomedical imaging, drug delivery, and a variety of others. This is a very good dual degree program for those who have strong interests in the engineering aspects of medicine. 30 credits are required for the master's degree. Those courses are taken at College Park, and the degree is awarded by the A. James Clark School of Engineering, Fischel Department of Bioengineering at College Park. Some example courses include biomolecular and cellular rate processes, a course that requires intimate understanding of differential equations, I will tell you. Cellular and physiological transport phenomena, physiological evaluation of bioengineering designs. The reason I mention differential equations is that really the only requirement that or the main requirement that they have for accepting students into the Masters in Bioengineering is that you have had math through differential equations. It's actually required for the transport courses. And there are several electives to choose from, and as with the other dual degree programs, there is an option for FRCT, and here it is a 6-credit master's thesis that's required for the master's degree that simultaneously satisfies the FRCT requirement. Finally, I'll talk a little bit about the Master's in Public Policy dual degree program. This is done in partnership with UMBC. Dr. Susan Sterrett is the chairman of the School of Public Policy at UMBC. Students will specialize in health policy in this program, learning about techniques for evaluating needs across the population, policy changes and their effects, and the medical needs of specific groups. 37 credits are required for the MPP. Courses are taken at UMBC, and the degree is awarded by the School of Public Policy at UMBC. And there's a list of several examples, statistics in there again, which is common to many of these programs, to learn methods for analyzing research data. In this particular dual degree program, 3 courses of electives in the School of Medicine can be applied towards the 37 credits required for the MPP. So there's 3 shared courses between the 2 degree programs. And as with many of these programs, we identified what those courses were in the legacy curriculum, and we will be reassessing that in the new curriculum going forward. There will be 3 courses, 9 credits that can be shared between the 2 programs. In this master's program, students are required to write a capstone professional quality health policy analysis paper that addresses a significant public health policy problem. That paper will satisfy the scholarly project component of the FRCT course. I don't have a lot to say about the other 2 programs. They're being fleshed out and really developed as we speak and as we move forward. Those are both with College Park. It's the MD Masters in Health Administration and the MD MBA. Have specific questions about those programs, please send me an email and ask those questions. So just briefly want to identify the other faculty members in the Office of Student Research. The office is directed currently by Dr. Carrie Tom, who has recently been appointed as the Associate Dean for Student Affairs, but she's still at the moment acting as the Assistant Dean for Student Research and Education, leading the Office of Student Research. In that role, she will be replaced when a suitable substitute has been found. Dr. Greg Carey is also in the office. He's the Director of Student Summer Research. He guides our summer research program, and he's also the Director of Community Outreach, and you know me now. So I want to just briefly talk about 2 other main important initiatives by the Office of Student Research. One of them is the FRCT course that I've mentioned several times. This is a course that was started about 7 years ago. It requires all of our MD students to complete a scholarly project. For most students, this will be an 8 to 10 week summer research project that is begun during the first summer between years 1 and 2. We've identified, I should have updated this slide, many more than 350. We probably have 400 or 500 faculty members from every clinical and basic science department who are interested in mentoring our medical students on research projects. When we started this course, we were pretty restrictive in the types of projects that would satisfy the requirement. We accepted hypothesis-based research projects only. We're now expanding that, particularly in the new curriculum, to allow things like meta-analysis or systematic reviews as other possible ways of satisfying this course requirement. I don't have the metrics to show you, but this course has been very successful. One of our reasons for developing this course was to improve our students' ability to get into residency programs, to make them more competitive for residency programs by allowing them to produce more publications, abstracts, and funding awards. And it's been very successful in that regard. The number of first authored publications has gone up dramatically after initiating this course. The final item I would just very briefly mention is our summer research program that's developed by Dr. Carey. This includes many funded research programs that are available to support student research. A lot of these programs are external, nationally competitive programs that our students have been very competitive for. But we also have an internal program that's called PRISM, that's directed by Dr. Carey, that's funded by money from the Dean's office, and that can supply stipends to somewhere around 40 to 60 students to support their summer research programs. So the program is designed to provide interactive experiences to allow students to develop and execute a creative research project. So in addition to the research experience over the summer, the students get a great deal of programming in terms of seminars, workshops, and other learning experiences that will help them execute their project. So that's all I have. Thank you for your attention. I look forward to hearing from you and maybe seeing you at the University of Maryland next year. Thank you.